Millions of Americans are living with high blood pressure, and they don't know it. American Heart Association recently published new guidelines on what is considered a high blood pressure number. It's the first update in 8 years. WECT's Ariana Bertolotti talked with a doctor today about what this means for our health. So is there anything surprising that people need to know about, Ariana?
John, I think the most surprising finding is the advocating for limited alcohol use and the connection excessive drinking has with hypertension. It comes as one of many contributing factors people should be aware of to reduce the risk of high blood pressure.
Dr. Frederick Mine has been practicing medicine for over 20 years, specializing in heart health and interventional cardiology. And with new numbers showing nearly half of all adults in the U.S. having high blood pressure, his job is more important than ever. It's also why he's paying attention to the American Heart Association's new blood pressure guidelines.
That they really take a lot of time and a lot of effort to empower patients to take care of their own health and their own blood pressure.
The last time guidelines were updated was in 2017. We all know the importance of maintaining a healthy lifestyle, but now, for the first time, this study uncovers how a healthy lifestyle affects your heart.
Stress relief, managing stress, managing sleep habits was the first time we've talked about sleep and sleep habits being an important part of health and blood pressure coverage.
And a big contributor to high blood pressure? Alcohol.
And there is a very clear link between alcohol consumption, excessive alcohol consumption, and high blood pressure.
Dr. Mine says patients should strive to stop drinking alcohol, but at the very least, limit 2 drinks for men and 1 drink for women.
1/10/7.
All right, so that's with no alcohol in my system. But if I were to ingest alcohol, what would that blood pressure kind of look like?
So probably for 1 drink or 2 drinks, just acutely, you wouldn't see a big difference. The concern would be over time, over many years of chronic drinking, we would expect that your baseline blood pressure would be higher, and that'd be the concern.
But he says the first steps start with simply knowing your blood pressure.
I'm always amazed when I see people for their first time in the office that very few people actually know what their blood pressure is on a daily basis.
Because Dr. Mine says it's never too late to take control of your health.
You done it last time.
Alive. So let's say, Ariana, that we haven't checked our blood pressure in a while, and we really don't. A lot of people know. I know mine's usually lower, but a lot of people may not, like you heard the doctor say.
Right.
So any signs or symptoms of high blood pressure that people might know about?
So I actually asked Dr. Mine that earlier, and some symptoms include feeling dizzy, tired, even nosebleeds. But for the most part, it's known as the silent killer.
Right.
So that's why you have to continuously monitor your blood pressure just to be on the safe side.
Yeah, it's always good to at least have a ballpark idea if you're low, if you're good, or if you're high, so that when it gets to be a problem, doctors can take care of it.
Exactly.
All right, good deal. Ariana, thanks.